If you have been advised a partial knee replacement, then you must watch this video, because in this video, I'm going to talk to you about different types of partial knee replacement implants, which one is good and how long does the surgery last. Hello friends, I'm Dr. Pankaj Walecha and I'm a hip and knee replacement surgeon in New Delhi, India. Over the last 20 years, I have helped more than 10,000 patients of hip and knee problems in getting back to their normal lives. In partial knee replacement, we only change one damaged compartment of the knee and the whole knee is not replaced. If you see this component, this is a total knee replacement component, wherein this is the thigh bone or femoral component and this is the tibial component or the leg bone component, and in between these two we put in a special kind of an insert which makes it a total knee replacement. But when we do partial knee replacement, we have only small part for the femoral component. As you can see, this is half of it, and you can see half of the tibial component, and you can see half of the plastic. So in partial knee replacement, only the damaged compartment is replaced, and that's why this surgery is less invasive and less painful and patients recover faster. There are two types of implants in partial knee replacement. The one which I'm holding has a femoral component which is fixed to the femur bone and tibial component which is fixed with cement to the tibial bone, but the plastic inside is moving. It is called mobile bearing kind of a partial knee replacement surgery. Here the plastic is moving and it's moving on a very smooth shiny surface which reduces the wear and tear of the plastic and which also gives better mobility. When we talk about fixed bearing partial knee replacement, the only difference is that this plastic gets locked to the tibial plate and it doesn't move. In a mobile bearing, we call it a meniscal bearing because it moves just like the meniscus or the cushion of the knee, and this meniscal bearing or this plastic in a mobile bearing actually replicates that movement and gives you more natural feeling in the partial knee replacement. These are the two choices you have and you can discuss what is best for you with your surgeon. When we talk about the performance of partial knee replacement surgery over the years, scientific data suggests that 95% of the patients are doing great at 10 years after the surgery, while 91% patients are doing really well even at 15 years. Does it mean that there is no complication, there are no challenges? Well, there are, because there is a potential risk of developing arthritis in the other compartments of the knee like lateral compartment or the patellofemoral compartment. So this is the lateral compartment. When only one side is replaced, then over the years, this side can also develop arthritis, patellofemoral joint can also develop arthritis, and if that happens, then you should be aware that you will have to undergo a total knee replacement surgery. But that total knee replacement surgery in majority of the patients can be done by using primary total knee replacement implants and not the revision ones where we have rods on both the sides and the components are bigger. Overall, a partial knee replacement surgery, when it is done well, for the right patient, it lasts at least 15 years for 91% of the patients, which is a very good number. And your knee feels quite natural when you have undergone a partial knee replacement surgery. So friends, I hope you found some answers to your questions about partial knee replacement surgery. And if you still have some doubts, drop your question in the comment section and I'll be very happy to answer that. Thank you for watching.